efforts to fight the coronavirus outbreak here in Arizona. Let's listen in.
Right, and Major General Mick McGuire on my left, the leaders of the Department of Health Services and National Guard and DEMA. I want to give you the latest update on where we are in Arizona. And I want to begin again by just saying thank you to all our healthcare workers, all our nurses and doctors. I've talked about this month as our maximum challenge to date. We know how hard they're working. I want them to know how grateful we are, how much we appreciate what they do for our citizens, and to the citizens, I want to say thank you as well. We're going to be able to share some things in terms of the direction Arizona is going. It could only be making improvements with your participation, partnership, and commitment to your fellow brothers and sisters and neighbors and friends. So I want to begin with a thank you to everyone, but specifically to those folks in the healthcare industry today. And I want to remind you, I've been saying this now for several weeks, you are safer at home. This virus is widespread in our state and in our country. People have been listening to this message, and it has been making a difference. Here are the latest numbers for the state of Arizona. 134,613 total COVID-19 cases, 3,501 average cases per week for the week of June 28th, 3,249 cases per week for the week of July 5th. And to date, we have lost 2,492 souls in Arizona. And I want to say to all of our citizens, I know the sacrifices that you've had to make, but coronavirus has touched no one more closely than those directly affected with the loss of a loved one. And our hearts and prayers remain with all of those families, and the actions that we'll want to take going forward will be to minimize virus contraction, sickness, and any death. In terms of our direction, our COVID-like illnesses in emergency rooms, which is oftentimes a leading indicator. And if you think of that, you go to the emergency room when you get sick. From there, you can go into a hospital bed. That is trending downward. Our COVID patient ICU hospital bed use, that's up, okay? And so much of the surge in cases that we had was in June. So those that became sick from the emergency room to a hospital bed to the ICU. And our percentage of positive tests, that is trending down for the first time in some time. And that is a good sign and a good direction. Let's take a look at the COVID-like illness surveillance. That's the blue line, and the influenza-like illness surveillance. If you can see, these lines were inverted as far back as December. The orange line is the flu, and it was flat. And the COVID line, the blue line, was flat. All the way up and including to the stay-at-home order. The flu has behaved like the flu the entire time through this. Coming out of the stay-at-home order, if you watch the COVID line all the way until June, it remained flat. And then a severe spike up over the next several weeks. And the first downward trajectory of the COVID-like illness surveillance in this past week. And a pretty dramatic leg down there. So that is a direct effect of the decisions that Arizonans have made over the past week, and we can see more of this if we do more of that. I want to talk about the COVID-19 cases by day. Those of you that can see that screen and see where June comes in, you might recall that for weeks and weeks I would come in and present this slide and say, there's not much of a trend here. There's a lot of data and information. About 3 or 4 weeks ago, I came in and said there is a trend, and it's going in the wrong direction. And it continued in the wrong direction for several more weeks. Today, we see the first evidence of the trend headed in the right direction in terms of fewer cases. So we need to continue to press this to have fewer cases, which will result in fewer sicknesses, fewer hospitalizations, fewer deaths. Percentage of positive tests. We had weeks, the gold line is the percent positivity. The blue mountain is the number of tests that are done, both PCR tests and this is just all PCR tests. And like I said, the line is percent positivity. We had weeks where the line was as low as 5.1, 4.9, and 5.9% positivity. Then through June, we had weeks where it was above 20 for several weeks. We now have it trending downward, and we need to continue to push that downward, and we're going to talk about how we do that. To show you where we are with hospital capacity. The orange line are COVID-like cases. They are on the rise. That began in June. We do have capacity, and the graph I'm showing you does not include the 2,660 additional surge beds, which we have not had to use up until this point. This is the intensive care unit hospital beds for COVID-19. Again, the orange line shows an increase in COVID-like illness inside our ICUs, pretty flat until June. That's where the increase happened, and this does not include the 600 additional ICU surge beds, which have not had to be used, so we retain capacity. This is ventilators for COVID-19. The COVID use of ventilators is increasing. Again, that began in June. Lots of capacity remains. This is testing by day. This is our serology test, is the orange part of the graph. The diagnostic is PCR. You can see that an ever-increasing amount of tests in the state of Arizona. We need even more, but we're at over 950,000 tests in the state of Arizona, and more on the way, and we're going to talk about why that will be important and how we'll apply that knowledge. Let's talk very quickly about some recent actions that we've taken with the intention to slow the spread of this virus. Prohibiting large gatherings. The local mask ordinances that have gone in effect in nearly all parts of our state. The fact that we have paused the operation of gyms, bars, nightclubs, water parks, and tubing. Delayed the first day of school and have reduced restaurant capacity to 50% with much tighter guidance. What we've been in since this began, and we have more knowledge about the coronavirus, is the very unhappy but necessary business of breaking up large gatherings and congregations of adults. The virus is highly contagious, and it spreads in groups. So the fact that bars and gyms and movie theaters, no concerts or spring training or large events happening, large venues are not in business, college sports, Major League Baseball, NBA, NFL may be preparing to play and compete, but that does not at this time include in-stadium fans. That's where we are today in Arizona. That's been the effort, along with what we've done previously and what we've done in the last several weeks to break up those larger gatherings of adults. Also, I want to say thank you to Arizonans, to our local mayors and county supervisors. This effort to get people wearing a mask in the state of Arizona. Nearly 90% of our state now has a local mask ordinance. I want to say thank you not only to the leaders, but thank you to the citizens for your compliance. It's making a difference, and we're going to show you the difference that it's made. What we've gone through and the challenges that I'm sharing with you really is Arizona's new normal, and it's our new normal for the foreseeable future. I really want to ask people to get their heads around that this is going to be a challenge that's going to be ongoing for the foreseeable future. And the better decisions that we make now, the better habits and disciplines and rigor that we have, the more success, the more people that we will save and protect around the coronavirus. This is our graph from the Arizona Department of Health Services. Many folks on the coronavirus task force, Dr. Deborah Birx, for one, talks about risk reduction, about making better decisions so that you can avoid contracting this virus and protect others. So if you were to look at a CDC website or the Texas Health website or California Health website, you'd find similar charts, likely different graphics. But this is informed by public health. This is not my opinion. This is not senior staff's opinion. This is the opinion of public health experts. So if you want to make better decisions, take a look at this graph. You can see that we've done a lot around our higher risk type activities to limit them in the state of Arizona and used government guidance or mandate where necessary. So let's take a look at the results. See where we are. I introduced this number 3 weeks ago. This is the R0 number. It's the average number of people who become infected by an infectious person. This is how the disease is spread. If you remember, I shared this on June 29th. We were at 1.18 in the state of Arizona. And if you go to the far left of the graph, you can see that's where the highest numbers are. To the further right, those are the states that are below 1. That is the objective, is you want to be below 1. You will naturally have decreasing cases. 10 days later, Arizona had moved 8 basis points to 1.1 on this graph. That was after we started to ask people to please make decisions around being safer at home. So we saw a pretty dramatic movement. Here we are now, the next week, moving 12 more basis points. So in total, we've moved 20 points in less than 3 weeks. And today, Arizona is below 1. We're at 0.98. Yesterday, we were at 0.97. So I said if you want to help our doctors and our nurses and our healthcare workers, if you want to help lighten the heavy burden that they have, the decisions that you make, the limiting of mobility will have something to do with that. Today, Arizona is below 1. And to show where we are in comparison to some other states and the fact of your good decisions and your actions that you have made have put us below 1. You can see where other states are, how fluid this number can be, and how dramatically we moved from one side of the graph to the other in less than 3 weeks. Thank you very much. What you're doing is making a difference in Arizona. Now let's take a look at another graphic that will show how the number of cases have changed from last week to this week. This is the New York Times graphic. They show it for every state and every country in the nation. This is how you can determine hot spots. The blue part of the map is in decline. The red and darker colors are where the virus is spreading, and the yellow is where it is stabilizing. So look at the dramatic change in Arizona's map in 1 week, week to week. Those are the good decisions that Arizonans are making around the state. Thank you. Newly reported cases in the state of Arizona, and if you can see, we were flat from March to April to May until June. A rapid rise upward, a flattening, and the beginnings of a slight decline. We want to push that decline further. We want to do more of what we're doing right now, but much of this gives us reason to be very cautious, but have some hope and optimism for what is possible in the very near future in the state of Arizona. We do look at other national outlets in terms of what's happening. This is the New York Times showing what's happening across the country. You can see our nation flat in April, May, and through June. A dramatic spike up in July while we are flattening and beginning a decline. It just shows how dangerous this virus is and how fast it moves. So the rest of the country is experiencing much of the increase that we had in June in July in macro numbers. This is another graphic in the Times that shows where new cases are increasing. For weeks and weeks, we were not on this page. And then what has, to me, seemed like forever, we have been on this page. And I've been getting up. If you touch this page and touch your state, all the statistics and graphics come up, and you can see how other states are doing and what best practices or interventions are making a difference. I got up very early this Monday morning and pulled up this page. I kept looking at it. I thought maybe it wasn't fitting right on my phone, and actually went and got my iPad. On this page on Monday, where new cases are increasing, I couldn't find Arizona because Arizona wasn't there. Arizona had moved to a new page. And I want you also to note that there's 40 states on this page, along with Washington, D.C. and the Virgin Islands. But Arizona had moved to this page, where new cases are mostly the same. So that's, again, we've gone from increase to a flattening, and where we want to be is the page below that. That's where new cases are decreasing. Today, there's only 2 states there, Delaware and Maine, but that's the aspirational goal of where we want to be, and we can make the decisions to get that done. We should view these metrics and the results we have with caution, but like I said, we have made some changes in the last 3 weeks, and this is the first good news we've had since. Last, if you want to look at the cases across the country, again, on this map, fire engine red is where cases are increasing, along with orange. Blue is where they're decreasing, and yellow is where they are stabilizing. So take a look at where Arizona is over the last 2 weeks and what a difference we have made in our state. And if those of you, and I do get some feedback on the different sources that I use, some people reach out and prefer that I wouldn't use the New York Times. Well, let's take a look to CNN. Here you can see that where it's red or burgundy, it's rising. Where it's green, it's leveling or going down. And where it's yellow, it's steadying. Arizona is in the green. There aren't many states in the green. This has been a difference in the last week because of the actions Arizonans have taken over the last 2 weeks. And some folks don't want to hear from media sources at all. I think they're important to point out. They want to hear from the subject matter experts. So if that's the case, let's hear from the standard bearer on these numbers, and that's Johns Hopkins University of Medicine. These are case trends in the United States, Ducey, and Puerto Rico, a 3-day moving average. Green is a downward trend, red is an upward trend. To my eye, there's only 2 or 3 states that are green, and Arizona has been green for several days on a 3-day moving average. So today I have better news, but I also want to say, so that people understand the truth around what's in front of us, there's no end in sight today. That's why I talk about the foreseeable future, and there will be no victory laps. What we can take from here is knowledge of what difference we can make in the COVID-19 pandemic in our state, in our country, for the foreseeable future. And to me, the takeaway is positive personal actions, responsible personal decisions, and taking personal responsibility for what happens will make a difference and better results. So we want to press on, stay the course, and do more of this. There can be no letting up. If we have any evidence from the last 2 weeks, it's what we've seen in these results. I've asked for your help. People have responded. I'm grateful. What you're doing is saving lives, protecting people, and giving lightening a load for a heavy load for our healthcare workers. So there can be no substitutes for things like masking up in Arizona. This is making a real difference, and like I said, we're seeing nearly 90% of our state that is doing this with wide compliance. The state, in addition to asking people to mask up and advocating, is funding PSAs around the reason to do it and providing and ensuring access to masks for vulnerable Arizonans. We'll have free non-medical cloth masks for Arizonans who are 65 or older or medically vulnerable starting tomorrow. So if you need a mask or want a mask, you can visit azhealth.gov/order masks to submit the order. The state's also going to work with licensed congregate care facilities to provide direct shipments to meet the needs of their residents in these categories. In addition to masks, physically distancing, keeping that distance between yourself and others, continuing to wash your hands, and remembering that you're safer at home. These are the things that today are making a difference in our state, and we want to continue doing them and doing them on a more widespread and consistent basis. Now I want to transition from this and talk a little bit about education. Arizona will be open for learning. That's what's in front of us in the coming school year. I've been visiting a lot with public K-12 education leaders, our school leaders and our superintendents, hearing from principals and others in terms of where we are, along with our fine public universities, visiting with Michael Crow, Dr. Michael Crow, Dr. Bobby Robbins, and Dr. Rita Chang to get their input on best practices and what's possible in this next school year. I want you to know that Arizona will be open for learning this school year. We've put a date out there about 5 weeks away. We've gotten the most recent input from school leaders and public school superintendents. I'm going to be sitting down and working with Superintendent of Public Instruction, Kathy Hoffman, along with other constituencies to get the best guidance on what we're going to do going forward. I know people want clarity around this, and we're going to provide clarity. I'm going to tell you, our kids are going to be learning in the fall. We're going to do our best to conduct the most positive educational year that we can, and I'll be providing the most specific guidance that I can I'm going to be working with Superintendent Hoffman on that, and expect that next week, and that will provide additional or include additional flexibilities to our schools around the state. Now I want to touch a little bit on expanded testing in our state. We touched on Project Catapult last week. This is a project that will have us doing 35,000 tests a day by the end of July. I showed you today that currently, with all the tests we've done over this time, we're at 950,000 plus tests. When we get to the end of July, we'll be conducting or have the capacity to conduct 1 million tests a month. By the end of August, nearly 2 million tests a month. This gives us more knowledge of the virus. You can think of how helpful this will be in schools and operating businesses, and that knowledge will be power to make better decisions and to protect more people. I also want to say thank you to Dr. Michael Crow and the innovators at Arizona State University. They introduced the first of its kind COVID-19 testing. It's saliva-based, it's pain-free, and has a number of advantages. The state is going to continue to partner with the university to ramp up this kind of testing as well. And Dr. Crow, as always, has big plans on how this testing can affect life at the university level for Arizona State University and others. We've got a couple COVID-19 test strike force sites for areas that need it. This is going to begin July 17th for 12 straight days. And I want to say thank you to our federal government and the administration for their help here. It's a partnership with the Department of Health and Human Services to provide diagnostic testing in Arizona, along with cloth face coverings provided to all participants. So 2 locations, South Mountain Park, you can see the address, and Maryvale High School, beginning July 17th for 12 straight days. Please, to ensure an appointment, pre-register at azhealth.gov/surge testing. And we're going to continue to make investments in public health in the state of Arizona. I want to give you a graphic on what we've done to date on this issue. I'm not going to read through every bullet point on this slide, but it's things from unemployment benefits to things to help our schools and local municipalities, things that will help with the supply chain, personal protective equipment, contact tracing, shoring up our high schools, along with planning for a safe and healthy future in Arizona while protecting our most vulnerable, our homeless, our people that are in a position of potential eviction, along with making sure that people don't go hungry in the state of Arizona. All totaled on this one page is over $6.7 billion that has gone out to the state of Arizona. And there will be more. I'm announcing today that we're contributing and investing an additional $50 million deposit to the Public Health Fund. And with that, we'll go to Dr. Kara Christ for a public health update. Dr. Christ?
Thank you, Governor. So the first thing we want to remind everybody is know the risk of the activities that you are going to be doing if you are leaving your home. So there's several questions that you should be asking yourself as you get ready to leave. And you want to know, how many people will you interact with? Remember, the number of people that you come into contact with increases the risk, especially if they are not in your household. Will you be able to keep 6 feet of space between you and others? Will you be indoors or outdoors? So outdoors has better ventilation, more room to space out. If you are indoors and in closer proximity, that's going to put you at higher risk. And then also, how long will you be interacting with other people? The longer that you are considered a close contact of somebody, the higher your risk is for catching COVID-19. So to talk about a couple of the resources that we are providing to our hospitals, we know that our hospitals have been on the front lines of the COVID-19 response since March. So we announced last week that we were implementing a staffing initiative. As of this week, we have a contract with Vizient Incorporated to provide nursing staff to our hospitals for 6 weeks. The cost of the entire program is being assumed by ADHS. So the way that we determined which hospitals would get staffing, our first priority was to keep patients in their community. So everyone's heard of the Arizona Surge Line, where we can transfer patients to the appropriate level of care at the appropriate time so that they can get the care that they need. If hospitals in rural areas, they told us if they had more staffing, they would be able to retain more of those high acuity patients. So they were prioritized, especially those that had a high number of transfers through the Surge Line to other facilities. The second priority was our large metropolitan hospitals that actually accept high numbers of transfers through the Arizona Surge Line. So staffing, we've already made the decisions. They've been granted to each of the health systems who applied. A total of 584 nurses will be provided to aid 21 hospitals around the state. It's 250 inpatient or medical surgical nurses and 334 critical care nurses. So these are going to be your nurses. They're going to staff your ICU beds. 74% of those nurses were provided to our central and our southern regions, because we know that those high acuity metropolitan hospitals are taking a significant amount of the transferred patients. The other thing that we prioritized is if that hospital was able to provide a specific capacity, such as ECMO. We wanted them to be able to have that type of staffing that could support those activities. So those will be on the ground within the next week to 10 days, and we are very excited that we were able to offer that to our hospitals. And last week, we talked about the post-acute care initiative. So we know that we have a number of patients that are in the hospital that could be discharged if they had somewhere besides home to go to. That could be a skilled nursing facility, an assisted living facility, hospice, home health. And so the executive order last week required those entities to report into our post-acute care capacity tracking dashboard, but we also know that we need additional beds. So the department has provided $10 million to expand that post-acute care capacity. We're currently in the negotiation of a contract with a skilled nursing facility system. That system actually has COVID wards and units, so we will not be introducing COVID into other skilled nursing facilities. This contract has the potential to add up to 330 additional beds statewide. And then we are engaging with other stakeholders, such as assisted living and hospice, to identify additional post-acute options. And then we are working on making sure that everyone knows how to utilize that PACT dashboard so that their discharge planners can utilize that to get patients out of the hospital and into a different environment.
Thank you very much, Doctor, and thank you for the good work your entire team is at the Department of Health Services. I know how hard they're all working, and all of Arizona is grateful. And now to Major General Mick McGuire for an update on the Guard and the Department for Emergency and Military Affairs. General McGuire.
Thanks, Governor. Since we last met, as I mentioned, our primary line of effort this week has been providing some operational capacity to the testing that's being provided by HHS and FEMA as federal partners to resource the 60,000 tests that will begin tomorrow. As the Governor mentioned, we'd asked that all my fellow citizens out there use the healthcare website, that surge testing site, to pre-register. We plan to do 2,500 tests per day at each of the two sites for a total of 5,000. When you arrive in your vehicle, you'll probably see Phoenix public safety and law enforcement folks doing traffic control along with some National Guardsmen. Some of our National Guardsmen will be assisting in registration and other logistics and wraparound services. And then our HHS contracted healthcare workers will actually do a quick test where it will be self-administered PCR testing, and then we've contract with an out-of-state lab so we don't put initial or additional pressure on our state labs, and we're looking to get those tests turned around in 48 to 72 hours. So look to get 60,000 Arizona citizens tested here in Maricopa County over the next 12 days. Additionally, on the rural testing, we just completed White Mountain Apache test blitz, Cibicu yesterday, and today the community of White River. 22 of our National Guardsmen out there assisting with our tribal partners, just as we have with Navajo Nation and last week with To'ono O'odham. And we are continuing to work to ensure the logistics and food supply, looking to extend our mission beyond the 24th of July in the food banks and the food distribution missions we've been running out of state to help the increased demand.
Thank you very much, and thanks for the good work of the Guard and DEMA. And boy, you all and your team have been on every front throughout the pandemic, and very grateful to the team as well. So thank you.
Sir.
I want to give an update on not only public health, but what's happening with Arizona families in the state of Arizona, especially families that have been displaced through this. Let's start with pandemic unemployment assistance and relief. Over $6.4 billion in unemployment benefit claims have been paid to date, helping over 958,000 Arizonans. It's almost impossible to get your head around that number. Before the pandemic struck, I think we had less than 17,000 people in our state on unemployment. Today, it's over 958,000. I want people to be aware that are receiving these benefits, that we are experiencing fraud attempts. They've been witnessed in other states. We've been working with the FBI and Department of Labor to continue combating this fraud and to ensure the dollars are preserved for the Arizonans that need them. And I realize it may have caused some inconvenience or slight interruption in some of your payments. We think we have our hands around that now, and there will be more to follow. I also want to talk about the housing protections for Arizonans protected by COVID-19. It's been some time since we talked about the March 24th executive order to delay evictions for those impacted by COVID-19. This established the COVID-19 rental assistance program administered by the Arizona Community Action Agencies. To date, we've put $1.2 million plus provided to Arizona renters, and the order is scheduled to expire July 25th. So I've got an update on this, along with a new executive order extending the eviction moratorium on residential evictions until October 31st, along with $650,000 for community action agencies to improve staffing and administration of rental assistance programs and providing assistance to families and individuals faster. In addition, $5 million to establish the foreclosure prevention program. And this will provide targeted relief to homeowners who rely on income from tenants to help them avoid foreclosure. In total, state and local governments have directed more than $80 million on programs to assist renters and prevent homelessness. Additional actions. Earlier this week, $1.6 million from the U.S. Department of Housing and Urban Development Emergency Solutions Grant was distributed to combat homelessness. This is going to support counseling service, guidance on independent living, rental assistance, as well as homeless shelters throughout the state. In addition, we've provided $250,000 from Chicanos por la Causa, and I want to thank David Adami for the organization's statewide housing program, which finds housing for homeless individuals. And in May, $300,000 provided to St. Vincent de Paul and Open Hearts, providing Arizonans in need with rental assistance, telehealth, and transportation to health services. So moving forward, our plan of action will remain to be a responsible approach, and it's going to be guided by public health. We are going to dramatically ramp up our testing facilities to identify these infections by increasing the lab capacity, along with additional collection sites focusing on the areas in our state and the people that need it most. We'll continue relief to county health officials and contact tracing to contain the spread, and we're going to monitor the efficacy of all our mitigation strategies and make changes and adjustments as necessary. I was asked a lot this past week on with all the metrics that are out there, if people wanted to simplify the metrics that they watched or the metrics that they could find to see if Arizona was going in the right direction, which metrics would I recommend? Many of the public education leaders wanted us to find one metric, and I wish that there were one metric that could simplify decision-making. But I wanted to point out 4 different metrics that I think if you wanted to get an overview of what's happening, and the first is cases. And I want you to know that in Arizona, with the way we're going to ramp up testing of 35,000 a day at the end of July and 65,000 at the end of August, you're going to see more cases. And the way to measure your level of concern on those cases is the percent positivity rate. So we're going to increase the testing. Will give us many more points of knowledge around the state of how we're doing, and we want to see that positivity rate coming down. That's both at the state and county level. And I think you could imagine, just from logic and common sense, the 954,000 tests that we've done to date have been done on sick people and symptomatic people and people that have been exposed to COVID-19. Now, there is a great demand for many people across the state who are not sick or symptomatic who want a test. Doing this should allow us to bring the positivity rate by its very nature. The next thing is the mobility and the R-naught. Arizonans are safer at home. This metric quantifies non-essential travel. The R-naught indicates the speed of the virus. So if you'll watch the mobility and the R-naught, you can help impact what's happening in the state of Arizona. And of course, capacity. Capacity is something we think about every day of the week and every day of the month. That's both the capacity in our fine hospitals and places where we can help people, but also our capacity of boots on the ground, doctors, nurses, staff, healthcare professionals, emergency responders, and people that are coming to help us from out of state where the federal government has stepped up. So next steps, in terms of action steps, please keep doing what you're doing. Wear a mask, wash your hands, physically distance, and stay at home. If you take these on as patriotic duties, you will help us reduce the spread of this virus. You will protect people and livelihoods, and you will remove some of the burden that is on all of our state and country's healthcare providers. And always, remember, wear a mask, the virus is widespread, and you are safer at home. And with that, let's move to questions.
Billy Harfosh, iHeartRadio. Thank you, Governor. I don't know if you've seen this yet today, but White House Press Secretary Kayleigh McEnany, she said, science should not stand in the way of reopening schools. You're about to make a very important decision next week on schools. The president has said he expects schools to be open. He also said he's going to pressure governors into doing that. Have you felt pressure from the president yet, and how much will what the White House says influence your decision?
I'm going to let public health continue to be my guide. I haven't seen that. There's a lot of breaking news every day, and I'm going to focus on my day job. I'm going to do what's right for Arizona. And I've said this several times. I'm not going to let politics get in the way of this. I want to do what's right for our state and for our kids, and our decisions to date have been informed by public health. Thank you, Billy.
Wanted to talk to you about where we are today and your response to this COVID epidemic up until now has led the state Is the county to the point now that they're bringing in extra coolers? Medical examiner is working under surge capacity to handle the dead bodies down there. I wanted to ask you, considering when you look back at this response, and it has not been successful up to this point, do you think you need to change up staff, bring in new perspectives, bring in new people to ensure that maybe this doesn't happen again?
So I want to say that I'm very confident that with what we know now, we can certainly avoid the type of increase in cases that we've seen. I have incredible confidence in the Department of Health Services, Dr. Kara Christ, and the people that are advising me on this. And I want, Dr. Christ, if you would talk about what's happening at the county facilities around some of the news and how that is affected by the environment of COVID.
Absolutely. Thank you, Governor. So when we look at fatalities management, there is a statewide plan. Every summer, we do see an increase in the number of deaths. When you look at what the medical examiner is looking at, the majority of those deaths are not going to be COVID-related. They're going to be the unexpected or the unexplained deaths that need to be investigated. We are working with our hospitals to ensure that they have adequate morgue capacity, but one of the normal elements of the plan is to bring in refrigerated trucks.
Yeah, but 2,492 deaths, is that a successful response?
We mourn every death that we have. We don't want to have deaths, and we know that if we can reduce the spread of the virus, and for weeks and weeks, months upon months, we were very slow in terms of case count. We did have that spike in terms of June. We've made adjustments, and this is something where you want to stay vigilant, you want to have flexibility, and be humble. We know more today, and I'm confident that we'll continue to make better informed decisions going forward.
I just got one more follow-up here about the R-naught. You said that this is a metric to watch, and as an example, you used where that was at June 29th at 1.18. This is an example of, you said, where you don't want the state to be. It happens to be that the R-naught was at 1.18 on May 15th, yet you opened up the state anyway. Why did you do that, considering that this is a metric that you are now saying is something to watch?
Well, it's something that you have to watch. I mean, and the metrics move, and we did not have the spike in cases that we have today on May 15th. And in hindsight, everything is crystal clear.
We're going to go to Andrew with the Republic next.
But Andrew, before you get started, the other thing I want to say is that on May 15th, in terms of where we were in positivity, which is another metric that we look at, it had slowed to a crawl. So there's a number of metrics that you look at in terms of making these decisions. Go ahead, please, Andrew.
I want to circle back to unemployment. Unless Congress comes through with something pretty quickly, a lot of Arizonans are going to see a pretty substantial decrease in their unemployment benefits very soon. What are you looking at doing on a state level to ensure that a lot of jobless Arizonans are not getting by on $240 a week?
Thank you, Andrew. And to date, through the pandemic, since Congress has been able to act, we've been able to provide displaced Arizonans $840 a week out of the Department of Economic Services. This is something we've been talking with the delegation about, talking with the White House about as well. There is a fourth package coming. We're not sure exactly what it's going to be. We're going to advocate for what's in the best interest of Arizona and Arizonans. To date, we've been able, to the best of our ability, and you've seen that over $6.4 billion to ensure that no one falls through the cracks or falls through the social safety net. Over time, of course, we want to see Arizonans, where possible and safe, return back to work. And I don't often get the opportunity to give compliments to Congress, but I will say that they have provided the resources to our state through this pandemic. And I think everybody realizes that Congress almost always acts at the last minute. So we are exploring what our options are and what the possibilities of what their trial ballooning and putting forward in terms of packages and amendments, Arizona's in a position where we have options, and we'll want to explore those options when and if necessary. I want you to know it's something that's topical among our senior staff.
Speaking of getting back to work, though, I think it was House Majority Leader Warren Peterson previously commented that people would go back to work when unemployment insurance is cut. Do you share that outlook, and is that even really possible if we're going to be in a situation where bars, restaurants, some industries are going to be operating at limited capacity, are going to be closed? Is that a reasonable expectation?
What we want to do is make sure that people don't fall through the cracks. What we don't want to do is incent someone who would otherwise go back to work to not go back to work. And even in the environment we're in right now, I mean, it's been my experience, most people want to work. Okay, they'd like to go back to their job if they are able. And in the last month, we've seen 19,700 Arizonans return to work. So we want to do the right thing, and that's what's going to guide us.
Do you think people feel it's safe to go back to work, though, at a time like this?
Well, it depends on who you are and where you're working, in your own personal situation.
Nicole, from AB 15 next.
Hi, everyone. Governor, you touted some positive news in today's briefing, but the reality is the state's largest county, they're bringing in 14 coolers to find a place to store the dead bodies, something that hasn't been done in 10 years. Bodies aren't able to be stored in a normal way now. The fact is bodies are adding up, space is running out. At this point, why should anyone believe what you're saying?
First, I want to say you're mischaracterizing what's happening in relation to COVID-19, and Dr. Chris can inform the rest of that and what happens in the state of Arizona, because we are headed in a better trajectory, because we went for weeks and weeks and months with a very slow increase in cases, and now we're going in the right direction again. Arizonans have been helpful, they've been partners, and they've been part of this. I'm going to ask them to continue to do that. Will you talk, hang on, please. Will you please, so people understand what's happening in the news that's being reported from the county level, again, reiterate for people that weren't listening the first time you gave
They
the answer
ordered
around.
14
Please.
coolers
Yes.
by next week to get them.
So we're working very closely with Maricopa County on developing a plan. So every summer we see increased deaths due to heat-related illness. We are also seeing increased deaths, unfortunately, due to suicide and drug overdoses. In addition, we know that we've got the COVID-related deaths. So what we are doing is we are working with Maricopa County on trying to get the decedents out of the medical examiner's office and into the funeral homes for final disposition, because they are almost at capacity. The rest of the state actually has capacity to handle any of the decedents or those that need care. But we continue to work and to identify solutions for our hospitals and the county.
Maricopa County hasn't ordered coolers in 10 years, though. And Governor, I've asked you what guides your decisions, politics, economy, science. You say public health, but elected officials, former elected officials, citizens, and businesses say your decisions are half measured. Are you trying to protect your image instead of making tough decisions?
There's a lot of critics out there. And if I listened to all my critics, I wouldn't have any time to focus on this pandemic. I'm going to make the best possible decisions informed by public health, do the right thing, and do my best. Now, I want you to know that there are two very loud lobbies out there. One is the lock it down lobby, and they want to see everything locked down. And they weren't even happy when we had a stay-home order and we did not have rising cases. The other very loud lobby is the government's not going to tell me what to do lobby. Very American thing to think and say, not during a pandemic. Both of these pretty loud, pretty large constituencies. Think of the decisions I've made, because I'm not following public polling. I'm following public health. So I'm not going to please the lock it all down forever lobby, and folks that don't want us to make decisions to protect people aren't very happy either. That's why I'm going to continue to follow public health. It won't be very popular, but I know in my heart it's the right thing to do, and that's what's going to guide decision-making going forward.
And just my last question really quick. The maps that you show up there, the White House put out a report on the 14th, and it shows most of Arizona all in dark oranges for new cases. How do you pick which charts you're going to show us? Are they to fit your narrative?
You should go to the COVID Trafficking Project. I think it's done by The Atlantic. It gives Arizona an A+ for the information that comes out of the Arizona Department of Health Services. That's on the website, azhealth.gov. Every map that's been put out there is reflective, but their source is independent. I put up the New York Times and CNN that validates what our own internal information is.
Okay.
We're going to go to Zoom next. Thank you, Nicole. We're going to go to Kathy Ritchie from KJZZ. Kathy, go ahead. Kathy, you need to unmute.
Sorry about that. Can you hear me?
Yes, we can hear you. Please go ahead.
Good afternoon. My question is really about testing in long-term care facilities. HHS said that there should be weekly testing of staff. I know that there have been 2 rounds of testing completed in the skilled nursing homes. That doesn't include assisted living facilities. There are 2,500 or so assisted living facilities in Arizona. What's the status of testing? Can we expect weekly testing of staff? And because that really seems to be the step towards reopening nursing homes, and it has been 19 weeks since families have had in-person visits with their families. So where are we at with testing in these facilities? Rapid testing results, which I hear is critical to the reopening, and weekly testing of staff, or even daily if possible. What's the latest on that and the reopening?
So thank you, Kathy. That is a great question because we definitely want anyone who's in a long-term care facility to be able to spend time with their loved ones, and we know that it's been a very long time. We are working with our federal partners. They will be distributing to our skilled nursing facilities rapid antigen tests that can be done in a very quick period of time, along with testing kits. That will allow our long-term care providers to test their staff weekly, but to also test patients and as well as visitors if that's what they wanted to implement. We're going to be working with those long-term care facilities to ensure that they have the testing kits that they need to have that ongoing. We are starting the assisted living testing so that we can move into that. Some of that will be done with grants to the actual facilities, and some of it is arranged through the Department of Health Services.
And what other, go ahead.
Oh, sorry, thank you. Will that be ongoing? Because what the skilled nursing facilities are getting, they're regulated by CMS. The assisted living facilities are not, even though the population is similar. So I'm just curious, if the skilled nursing facilities are getting those rapid tests, assisted living, will that be ongoing? What's the status of that? Because so many Arizonans live in assisted living, whether it's a group home or an assisted living center.
So we are taking a look at that. Our priority would be the assisted living centers on that, but we're looking at what the capacity is to be able to offer that to our assisted living facilities.
So that's not the ongoing testing then right now is not happening. You're still sort of planning that. It's in the planning process.
Yes. So that part is still in the planning process as we're starting the testing for the assisted living staff and residents.
Okay, thank you.
The other thing I want to say to Kathy is that we should add that to our list of incentives to remember that it's safer at home and to wear a mask and to socially distance. We do have guidance available once we get into a safer area in terms of case and spread, where people can go visit their loved ones inside a nursing home. Part of it's the guidance and the testing, and I know how much people want to do that, and we want you to be able to do it in a safe way, so we need to continue this downward trajectory.
We're going to come back in the room. Vaughn, can we get to NBC News, please?
Couple questions. St. Luke's, is there an update that you guys have to my understanding, you guys have signed a contract and signed a lease with the building. And is that the same thing as the skilled nursing facility that you guys introduced to us in the earlier graph? And following up on Kathy's question, it sounds like Sonora Quest is making great strides. They're going to have their machinery in there to begin to expand testing operations here for the actual processing. At the same time, what do you guys see as the future of expanded rapid testing here in the state? And sorry, my one other piece here is more along the lines of, not from the shut it down lobby, but I was just talking with an ICU nurse who spent 2 months, May and June, in New York. And he said he was disheartened. He just came back and he's now working out of a hospital here. And he said compared to what he saw in New York, and essentially how those streets were shut down, and folks took it seriously and were able to bring their case number down quite rapidly. He said then he came back here and he's concerned that this is just going to be prolonged. And he said he's encouraged to see those hospitalizations plateau and some of these early indicators, but we still have a percent positive number, 20%. To folks like Shannon Sims, that ICU nurse, what would you tell him in terms of why not take those additional steps of not shutting down like indoor dining at this point?
Will you touch on St. Luke's and testing, and I'll talk about the policies?
Sure, thank you. Thanks, Juan. For St. Luke's, so we do have St. Luke's ready as a warm site. We have a contractor that could come in, provide the equipment and the staffing, and run St. Luke's. That is, we've always had that as kind of a last resort option. It is ready to go. What we would like to see is Arizonans provided care in licensed, regulated facilities. And so working with our long-term care providers, that would be our first option. However, we do always have St. Luke's if that is needed. So that's where we're planning right now. For the testing, so yes, Sonora Quest has done a phenomenal job, and we are so excited that they have been able to add capacity. We are looking at the possibility of rapid tests. They are not as efficient, and so they really are that 1-by-1 or 1-by-2 type test, like if you had a visitor that was coming in, or if you needed to quickly assess whether a patient should be in COVID precautions or not. As they become with the rapid, the antigen test, that will be more like a strep test that you'd be able to do in a doctor's office. The sensitivity and specificity aren't really what the PCR is, but it's a really good, just quick answer. So we're looking at how we could deploy that statewide. But the other thing that we're doing is looking to enhance the access to testing. So we're working with some of our county health departments to identify areas in Pima County and Coconino so that we can expand testing throughout the state.
Is that rapid testing, has Sonora Quest indicated that they're going to be looking to expand that as sort of their next step?
I haven't talked to Sonora Quest specifically about that. Usually those are kind of point of care in like doctor's offices, and so it may be something that they're looking at.
And Vaughn, the answer that I would give is that we want to do everything we can to break up these large gatherings. That's the evidence that we have that's guided by public health. And I know I get requests from across the board, and I know people in all of these camps. My decision is being informed and guided by public health. And I know that's not the popular decision, but I believe it's the right decision. And I know over the course of time, as we get through this, Arizonans will see that it was that discipline that will steer us through this.
When you see places like Prescott was blue on that map, and you saw the images yourself over the last 2 weeks, does that give you pause that maybe you should take that additional step of like a statewide mask ordinance?
I want to see the maximum compliance with masks. I want to see every Arizonan wear a mask, including all my friends in Prescott. And I believe the decision that we're making in allowing this final decision to be made at the local level depoliticizes an issue that should never be politicized and has wider compliance. So I'm going to leave that up to those local officials and maybe some of the evidence that they're seeing, because if you remember, it wasn't that long ago when we gave the authority to the local mayors and local county supervisors that Yavapai County was at 3%. And today, like you said, they're blue and in a position where action would be helpful.
Thank you, guys.
Go to Michael from 12, and then Holly from Cat Media Services.
Thank you, Governor. With the county officials ordering those 14 coolers, they're saying they're worried about a clog, potentially, when it comes to the number of deaths and not having space for those bodies. And like you said, the one trend that you said that is going up is the number of ICU beds and hospital beds taken up. What should people be expecting when it comes to potential deaths moving forward over the next couple of weeks?
Well, I can't predict the future. I know that if we reduce cases, we'll reduce illnesses and we reduce hospitalizations. And I just want to reemphasize what Dr. Chris said about what happens in the summer and what happens during flu season. And she also mentioned something that I think is lost from much of this discussion, because our focus is and should be laser focused on COVID-19. But she talked about the suicides and the drug overdoses that are happening. So public health includes many things, and that's what we're addressing.
But the concern is more than just, 14 coolers is a lot. I know they may be trying to go above and beyond, but.
I think Dr. Christ answered this question twice.
Well, I got a couple more quick questions for you. You talked about education, making a decision next week. Superintendent Hoffman said you've called the date August 17th aspirational before. How optimistic are you that August 17th is really going to be a date that we can see something real?
I'm going to visit with Superintendent Hoffman, and we'll have details next week.
Okay.
You want to make sure we get to as many adults as possible. We have a lot of people on Zoom, so if we could, we're going to Holly and we'll try and get to as much as we can.
Just one quick last question for you. Yeah, last one. Yeah, on the Wall Street Journal, we saw from Sonora Quest, their leader, they said that they thought that this virus may go away during the summer, or at least reduce during the summer. That didn't really seem to follow the facts. Did you actually believe that this would go down during the summer?
You have a question for Sonora Quest. We've been preparing since really sometime in March for a worst case scenario. That's why we talk about 600 plus ICU beds that we haven't had to use, 2,600 hospital beds that we haven't yet have to use, the amount of investment that we've put into testing. So we've always been planning ahead. If you've got a question for leaders of other organizations or businesses, I ask you to ask them.
Well, we rely a lot of them on testing, and they said they were behind on testing because of that.
Yeah, and that sounds like a question for them, because we want testing ramped up. And we're sharing with people that we're going to have 35,000 tests a day by the end of this month, 65,000 tests a day by the end of August. And to date, we've conducted 954,000 tests. We need more, and we need more rapid results, and that's what's on the way.
Let me start with you, Dr. Chris, because you mentioned something about a rise in suicides and drug use, and also affecting the fact that we've got a lot more bodies in the morgue. Are you somehow linking COVID and the virus and any of the orders to the rise in suicides and drug use, or is that just seasonal?
So the heat-related illness is how we would be seasonal. We are seeing an increase in drug overdose and in suicides, not just here in Arizona, but nationally. And so could some of that be associated to the isolation and loneliness? That was one of the things that we were worried about. We wanted to make sure that Arizonans, when we had the stay-at-home order, also had this stay connected. And we do know that this has been hard, particularly on our students. And so that's just one of many things that's playing a role, unfortunately, in what's going on at the medical examiners and at our hospitals.
Okay. Other question for you, Governor. As you know, CDC issues state-specific recommendations every week. And the latest recommendations from the CDC say to limit indoor dining to less than 25% and decrease gathering limits to 10. We're at 50% and 50. You keep telling us you're following CDC guidelines. Why aren't you doing that?
I'm informed by the guidelines of CDC. Those are our recommendations. We've restricted in-store dining or in-restaurant dining to 50%. We're 5 days into this. We're seeing the results that we've seen over the last 2 weeks, so we're going to continually monitor it.
So at this point, you're not interested?
We're going to continually monitor it. We've also put additional guidance that limits the amount of people that are in there. The key is to socially distance and make those responsible decisions. But listen, we'll make adjustments, and like I said, they'll be incremental, and they're targeted and focused on better results for our state, and we'll continue to do it, and they are guided by public health.
Great, thank you.
Hello, Governor. Good to see everybody. I'm sure a lot of Arizonans are very happy you extended the eviction moratorium today. Maybe not so much landlords, but I want to ask about the Renters Assistance Program. That money is getting out at a snail's pace. We've been doing our independent, we're talking $20,000 in a week, maybe even $5,000 in a week. Is that program a failure? We've heard about backlogs in counties and whatnot. There's still a lot of money left and a lot of people who need it. Is that program?
The program is not a failure. I think you may have seen earlier in the presentation that we've had over $5.4 billion in federal funds go out. That's $840 a week to people. So if you're receiving $840 a week, which we're told for many that were displaced is actually more money than what they were receiving before, their rents are up to date.
And I want to switch gears to educate. I'll keep this.
Or they should be up to date. We also, I would ask, we don't want people to fall behind on their rents. If the conviction order is not there so that they don't pay their rent, it's so that they don't lose a place to live. It's so that homelessness is not increased. But if you're receiving those federal dollars, and there's 951,000 Arizonans that are in receipt of them, they should be up to speed on their rent and their mortgage, and most of them are.
But there's still that backlog. There's still that backlog in counties and
we put additional dollars in there so that we could get additional monies to the counties so they could be more responsive. That's part of the order.
So real quick, just to pivot to education real quick. I know you're going to be meeting with the superintendent. I know you guys have had a lot of conversations. But you yourself, would you feel comfortable sending your kids back to school now? You would?
Yes.
You have no qualms about it at all?
Well, I want to turn that over to a public health expert who has 3 kids that may be in school. Will you just answer from a public health perspective, please?
So thank you. Yeah, that's a great question. And right now, we had to just make the decision on whether our children would be going back doing either the virtual academy or a in-person school when it resumes. My husband and I made the decision that we would like our children to be back in school. We know, based on the information we have right now, that kids are at low risk for transmission and for outcomes. I have noticed some other detrimental impacts from my kids not being in school, and I really would like them to be back in that social environment.
Thank you.
We're going to go to the Zoom board next. Hank Stevenson from the Yellow Sheet Report. Hank, go ahead.
Thank you, Governor. So you say that your decisions are guided by science and data. Are you willing to commit to opening schools based on science and data, some sort of a metric system rather than an arbitrary date?
So Hank, I'm going to work with Superintendent Hoffman. Our decisions are going to be informed by public health and the safety of our kids, our teachers, the staff, and the people that work inside our schools. There will be more to follow on that.
That didn't answer the question, though, Governor. Right now,
I said it will be informed by public health.
Yeah, and informing it by public health, most people would agree that that means going off of data rather than a date. Are you sticking to a date, or are you going to set it based on data?
Hank, I said that the date is aspirational. We have some of our school leaders who we're listening to who have already made some decisions around their schools, but the learning is going to begin on or before that date, regardless of the decisions that are done either at the state or local level. There will be more to follow on this next week, more specifics.
We're going to come to the room. We're going to go to Courtney with ABC 15, and we'll go to Jeremy.
Hi, Governor.
Hi, Courtney.
I'm going to switch gears here a little bit. In the weeks since you met with Black pastors, Black parents, to talk about police violence, systemic racism, there have been several shootings. You've indicated a willingness to diversify AZ Post, de-escalation training, body-worn cameras. What is your timetable on getting these things done?
Thank you, Courtney. The visit and subsequent conversations that I've had with leaders in the community have allowed us to focus on a number of things. One, it was this to-do list of actionable or deliverable items. One was the idea that in these areas they have health issues around COVID-19, and they wanted more focused testing, and you've seen that ongoing. You've seen it in today's announcement as well. The other idea was what the governor's office can do around the diversification of AZ Post. We're working on that as we speak. And then there's additional things that we're going to do from the Department of Public Safety in terms of how we handle training inside the state, and that's being led by my Colonel of Public Instruction, Heston Silbert, and I know he's working with Jerry Williams and Paul Penzone and I believe Chris Magnuson and others.
Are there other things that you are looking at doing yourself without legislative help?
Well, first I want to say I want legislative help on this. The legislature was on board for body cameras, and body cameras was another request, and that would have happened in this legislative session, except we closed up rather quickly because of what happened with COVID-19. So to me, I think the best policy is done when you've got the branches of government working together. So we want to be working with the community and be doing the right things that are measurable and that will make a difference. 3 of them we can do by and large through the governor's office. The other, we're going to need the legislature's help, and I think there's more beyond that.
And this is my final question. Legislatively, are you looking to have a special session of any sort about COVID, about police reform, about anything?
So I continue to talk with legislative leaders. I had a visit with Rusty Bowers, the Speaker of the House, and Senator Karen Fann, President of the Senate. I know that we're also engaging the delegation, and as necessary and if necessary, we will do that.
Thank you.
Hi, Jeremy.
2 questions. First, a few weeks ago, you ordered the Department of Liquor to stop issuing licenses for large gatherings, limited or restricted gatherings of more than 50 across the state. There are still a lot of events on the calendar for the remainder of the year that the Liquor Department had already approved that will have, God knows how many people, a lot of them sometimes in places that don't require masks. Have you given any thought to canceling those events to prevent, these large gatherings that could potentially spread COVID?
We're going to review things that are on the calendar or things that are going to happen in the future that have been planned and where government has a role in that decision-making or local government has a role. We're going to be advocating or making the necessary decisions from our office.
Okay. Second question, the Commission on Appellate Court Appointments this week announced that it was starting to take applications for the Redistricting Commission. Now that commission, according to the Arizona Constitution, is supposed to pretty closely reflect the population of Arizona. Currently it has, I think, only 1 non-white member and 0 Democrats. Do you plan to fill, I think there's 4 vacant seats, do you plan to fill those seats to make it more reflective of Arizona's population before they select these redistricting applicants?
I think you'll see the applicants and the decisions be more reflective.
Before the redistricting candidates are selected?
Yes.
As we start to wrap up here, we're going to go to Zoom next for one more question. This will be from Brenna Goff of Bloomberg News. Brenna, go ahead.
Thank you, and hello, Governor. You are one of 5 governors around the country that are facing recall efforts based on some of the executive actions taken during the course of the pandemic, mostly aimed at slowing the spread of the virus, such as shutting down businesses. And I'm wondering what your response is to the citizen groups around the country that are organizing these efforts and saying that the actions go beyond a governor's power, that they are unconstitutional, and that they infringe on people's rights.
I would say to them that I'm 100% focused on the pandemic and making the right decisions from the governor's office to protect people and doing the right thing. I'm not paying attention at all to politics or these groups that want to say that a governor doesn't have the legal rights that I have been granted in a public health emergency. I can't wait to have government restored to how it was before the pandemic, but that's not where we are today. So with that, I want to just say thank you. We've seen some encouraging news today. I want to reiterate that it's not a victory lap. It should be a validation of the decisions that we make as citizens in terms of personal actions and personal responsibility that we take can make a difference in our state. I want to thank Arizonans from across the board for staying focused on the task at hand and what's in front of us. Let's keep pressing in this direction. And if you will, the message is you are safer at home. But if you need to go out, what I'm asking you to do is just to limit that mobility. If you need to go out to eat, to limit that mobility and head home. And make sure you're wearing a mask, that you're helping other people understand the gravity of this situation. There's strength in numbers here, and the more numbers that are making the better decisions, the better off we will all be. Again, thank you to everyone, especially our healthcare workers.